are so many questions we get from viewers out there. A lot of women who feel maybe a little bit embarrassed about asking questions because there's a lot going on with our reproductive system. There's just a lot going on generally down there. So Dr. Marjorie Dixon is here. What's going on? There is a myriad of action happening all the time, and if you don't know that something might be off, you don't know to go to a doctor and get it checked out, and that's what we want. We want to inform everyone.
And there's not all things coming out of a vagina are created equal.
Right.
So it's important for us to be aware of normal discharge, and then what's abnormal discharge, and even the varieties of abnormal discharge.
You need to know.
You need to know.
That's right, and then you need to teach that information to your daughters,
Absolutely.
right? If you're out there and you've got kids, like, they need to know this stuff.
Absolutely.
We don't want another generation of kids growing up and not feeling they can talk about this stuff.
No, right.
Because they need to get checked out. Okay, so let's start with bacterial vaginosis.
Bacterial vaginosis is one of the most common abnormalities of vaginal discharge. Bacterial vaginosis, 50 to 75% of the time will be asymptomatic. Women, it won't really know if it's that different, but they'll notice that there's a smell.
Right.
Right? And so vaginas aren't made to smell pretty, so you shouldn't be douching, smelling, scenting, powdering. Just plain water wash.
It's not a rose garden.
It's not
is
a
what
garden,
you're trying to say.
It's a vagina. Yeah.
It's a vagina.
Yeah. And
but you don't want it to smell badly.
You don't want it to smell badly. So the typical smell of this is a fishy odor for bacterial vaginosis. And actually, when you go to the gynecologist, when we actually say, well, we're going to take a swab of the discharge and see if we can identify what's going on, and we're looking for specific things, but one of them is the smell. So bacterial vaginosis smells fishy, and actually there's something called a whiff test.
Okay, so you got to actually go in there and take a whiff.
Well, yes.
That's what it is.
The whiff test is after the doctor has taken a swab. So we use one of these swabs, and we go in. Actually, I'll show you what it looks like. And this is a model of a woman's pelvis, but a little woman. And then you go right into the cervix, and you take a little swab, and then it goes back into a little container.
Yes.
And we send that off for pathology, like we figure out for cytology, rather. We want to see cells, and we're looking for what are called clue cells. Okay. But before we send that part, that's one of the tests. But we can also put on a slide, and we look under the slide that's a wet prep, just a little bit of saline, and we look for these particular cells that are clue cells. And then we also have this whiff test that I talked to you about. It's potassium hydroxide, so the doctor diagnostically, it already smells badly, but when you put a drop of potassium hydroxide, it really smells, and that's the whiff test. So that's for bacterial vaginosis.
So if it really smells, then there's a problem.
If it really smells, there's a problem, and it could be bacterial vaginosis, but other things are smelly, so I'll tell you about those too. But the bacterial vaginosis, it's easy fix. It's an antibiotic, metronidazole gel or Metrogel, or you can take an oral antibiotic. It's the same type of antibiotic, and that will particularly treat that bacterial vaginosis if that's what you have. Okay. There are other discharges that smell too.
Yes, like what else might be smelly?
Well, so you might have, yeast infections are not so smelly, but okay, let's talk about yeast infections. They're itchy, very itchy. Yeah. So that's characterized particularly on the outside, so I know this is transparent, but right in the perineal area, between the anus and the vagina, that part gets really irritated because of the discharge there. Yeah. And the discharge isn't like the more off-white palish of bacterial vaginosis and thin. This is, again, food, cottage cheese-ish. So
can I ask you two things before you go on? What causes bacterial vaginosis and what causes yeast infections?
So bacterial vaginosis is an overgrowth of the good bacteria in your vagina. Okay. Right? And then also, you're at risk if you've had more than 3 sexual partners in a year.
Okay.
Yeah.
All right.
Yeah. So it can be transmitted. So you want to be sure that if it is identified, that you treat it with the antibiotics.
Okay, and what about yeast infections? What makes them happen?
Yeast infections is overgrowth of the yeast. So the yeast gets happy. Sometimes if you've been on antibiotics, so if you've had chronic illness, if you're immunocompromised, you're at greater risk of developing more of these yeast infections.
Okay.
So some women are prone to them, and some of the yeast can be fancy yeast. So not all yeast is created equal. The more common yeast we can treat with over-the-counter things. So if you get itchy and red in that perineal area that I showed you, you can go to the pharmacy and get just over-the-counter yeast treatments that are either ovules. So I have like an example of some ovules, so they're kind of hard, almost like tablet types. Yep. And this is the applicator. I'm not having a good time with the applicator, but anyway. Yeah. So you put it in the tip, and then you apply it, because vaginas are long. So you put it all the way in, and then you plunge it in. That would be for that. They also give you a little bit of extra cream to help you with the itch. so that you put it on the outside. So you have the tablets that you put right inside,
Yeah.
and then the yeast on the outside. And sometimes even there's little hydrocortisone that you get over the counter if you're really itchy, because you don't want to get into the itch scratch, because that will irritate the skin there, the very sensitive thin skin there,
Yes.
even more. So you can get a little hydrocortisone cream and put it on there too.
All right, good. Okay, so we've talked about yeast. We've talked about bacterial vaginosis. Let's talk about.
Can we talk about trichomonas?
Let's talk about trichomoniasis.
So it's very, very itchy, and again, we talk about food. The cervix looks red like a strawberry cervix, but the cervix also gets irritated, so it might manifest itself when people are having intercourse. They might have a little bit of bleeding along with this interesting discharge, and they may actually have pain too, because sometimes it can irritate the uterus as when you have intercourse. There's action at the cervix, it moves the uterus a little.
Right.
That can cause pain, so pain with intercourse can also be one of the signs. It's also bad smelling, so it doesn't smell fishy, but it doesn't smell right.
Okay.
So that's the other one. But the diagnosis is you take a little bit of the swab and you put it under a microscope with the things, and you see the things swimming. Yikes. Yeah.
Oh, it's
It's
what is
sexually
it?
transmitted. It's a sexually transmitted one.
Okay.
And if you ever get anything that's sexually transmitted, please make sure that you also have a blood test, HIV, hepatitis. You need to be screened for those things, because that means that you've been exposed to things that are potentially very dangerous to you.